Today's Community Spotlight will feature the Alzheimer's disease and related dementias program that is through the Division of Public Health, the Idaho Department of Health and Welfare. And we are honored to have Tiffany Robb, who is the health program manager for the ADRD, the Alzheimer's disease and related dementias program, with us this morning. So a little bit of background information on Tiffany. She holds a Master's of Health Science and Health Policy. She is the health program manager for the Alzheimer's disease and related dementias program. And outside of her work with the ADRD program, she enjoys teaching at Boise State University, and she is passionate about empowering people and family caregivers. So at this point, I'm going to thank Tiffany in advance for sharing her time and her expertise and for being with us this morning. And I'm going to turn it over to Tiffany.
Thank you so much, Mary. We'll get those. Thank you, Dara. Thank you everyone for allowing me this space today and to share this with you. As Mary said, I'm the program manager for the Alzheimer's disease and related dementias, or otherwise we say ADRD, just to make it short, public health program for the state of Idaho. And we'll move to the next slide. Now, something that I think is super important before we get started is to make sure we're grounded on the same platform with definitions. And so I've provided a few definitions here so that we're just, again, on the same page as we move forward. So cognitive impairment is a decline in an individual's mental abilities that is noticeable to the person experiencing it or others that are around them. And this decline is not necessarily severe enough to interfere with their daily life, and may potentially be reversible if treated. And that could include medication complications, bladder infections, and so on. There's all sorts of different things that could be incorporated in their thyroid, whatever. Subjective cognitive decline is a self-reported form of a cognitive impairment, and the individual could be experiencing this as it's worsening, and the frequent confusion or memory loss is, again, it could be worsening as well. Now, dementia is a general term for symptoms that describe that decline in a person's mental function that impacts their daily life. And then, of course, there's the shiny Alzheimer's disease that we all know of. And this is a cause of dementia. And it is genetic, it can be genetic, and other times it is not always, that's the thing. It can impact individuals younger than 65 years of age, which is so important for people to understand and know. And then with that, I'm going to go ahead and go to the next page. So as Mary had said, the Alzheimer's disease and related dementias program is housed at the Department of Health and Welfare within the Division of Public Health. Now, why is that important for all of you to know? Because with this program, we're taking that public health approach with looking at how we address Alzheimer's disease and dementias. So the reason why I say that is because this model here that you see on the screen, if you look at the very bottom of it, it says birth to death. And so when we look at addressing Alzheimer's disease and dementias, we are looking at it from a birth to death process, looking at the risk reduction side of things, looking at the early detection and diagnoses, those benefits and so on, as well as providing safety and quality of care for those who have MCI or mild cognitive impairment, all the way up to a diagnosis of dementia or Alzheimer's disease. And we'll go to the next slide. Thank you. So how was the ADRD program realized? Go ahead and we'll click to the next. A bunch of advocates and entities here in Idaho knew this specific data that I'm providing on the screen here, that there are 27,000 Idahoans with an Alzheimer's disease diagnosis, that there's 42,000 Idahoans who are caring for those 27,000 individuals, that $149 million was paid by Medicaid In 2020, 4 services for persons with Alzheimer's disease. Now, these last couple of bullet points are super important that really point to our public health side of things, is that 40% of dementia cases can be delayed or loosely prevented. We say prevented because that's a sticky term when we talk about dementia and Alzheimer's, through a public health approach. And 10.8% of Idahoans reported subjective cognitive decline, of which 56.7 did not follow up with speaking to their healthcare provider about that subjective cognitive decline they were experiencing. And remember, through that definition, that is impairing their life or their daily life quality. And so these are the reasons or the bullet points or the talking points that Idahoans advocates had taken to our Idaho legislators. And in 2021, our Idaho legislators deemed this as an important area that we needed to focus on as a state, and thus the ADRD program was formed and my position was created. And with that, we'll move to the next slide.
Fine.
Now, you're good. Now, a part of creating the ADRD program, one of the responsibilities that we want to make sure that we hold true to is really reaching out to Idahoans across the state and finding out what are they experiencing, what are they not experiencing, and how can we better improve the services, supports, and education throughout the state as it relates to Alzheimer's disease and related dementias. And so in November of 2021, we created the ADRD Alliance. Now, currently that alliance stands at 172 members on the roster who are family caregivers, concerned citizens, all the way up to policy leaders, and so on. We meet as an alliance monthly, and the idea of those meetings is really to build the relationships across the state, to learn what people are doing, and to find out ways that we can collaborate, because we need to be efficient with our dollars and innovative with our approach. The other thing that we do when we're meeting monthly that's really important right now is guiding the development in that 5-year strategic plan that we are working on building at this moment. The other thing is that we are determining at the alliance, I say we, I always say the proverbial we, are determining the best way to expand ADRD and brain health services, supports, and awareness across the state of Idaho. And now I brought in brain health because that really helps us get to that risk reduction side, which is how can we get Idahoans to be aware of taking care of their brain during those early stages, which can delay the dementia state if possible. And we'll move to the next slide. So what are we working towards currently right now? And we'll move to the next, thank you. So the ADRD program, which again is housed within the department, is beholden to a few specific commitments that we've laid out for the state legislators, as well as to our federal funders. And I think that it's important to put that out there right now. We do have state dollars that we receive to run our program. That's my position here and a few extra dollars that we can put towards some things. And then once the state did designate general funds, we were informed by the CDC that we would receive 2 years of federal funding that we had been previously denied. And so in turn, again, we are beholden to both of those entities as well as all of our Idahoans for these specific 5 activities that we're going for. And I'm not going to read them to you. I'm going to save you from me putting you to sleep. But those activities include educating Idahoans, expanding their education and awareness of brain health, as well as early detection and diagnoses, increasing education and awareness for family caregivers, providing them the caregivers, as well as increasing the community on the value and the importance of caregivers. Working towards, collaborative efforts across the state, as well as with existing public health programs, making sure that we're utilizing data to really move things forward. And then, of course, tackling our healthcare professionals, which is so important because in a state like Idaho, we do not have the neuropsychs that we need, and then we do not have the geriatricians that we would need to really appropriately serve the population that we have. And thus we need to educate the healthcare providers that we do have in Idaho to feel confident in diagnosing and in navigating the system with their patients. And so we'll move to the next slide. So as I had mentioned earlier, because we're in the public health or division of public health, we run off of a public health model. And so that public health model of prevention. And so what does that mean? That means that we're taking brain health and ADRD and looking at it in a 3-point phase or level. So the primary level, improving brain health, reducing risks of or delaying dementia much earlier through lifestyle choices and proper chronic health management. In the secondary level, what we're looking at are those benefits of early detection, educating Idahoans on detecting early, as well as the healthcare providers, educating Idahoans on having conversations about brain health with their healthcare providers, helping them understand the value of managing their chronic health conditions, as well as identifying those family caregivers as early as possible, giving them the education and support they need before the house is on fire. And then let's go ahead and move up to the tertiary level, where the house is on fire. When somebody has a diagnosis of ADRD, we really want to make sure that there are supports and services available to a person who has a diagnosis, as well as their family caregivers, and make sure that persons know that there are services that are available in their community. The other part of that tertiary level is really working with Idaho communities on decreasing the stigma around dementia, so that individuals who have a diagnosis of ADRD and their family caregivers do not experience the amount of isolation that most people do currently at this time. And so with that, I'm going to go ahead and move to the next slide, please. Now, what is the ADRD Alliance currently working on? As I had mentioned previously, they're working on revising our state plan. We did have a state plan that was developed in 2013 by a bunch of individuals all across the state, but unfortunately, we didn't have the capacity as a state to continue to actually get those actions that were defined in that state plan moving forward. And so hence my position now. So I get to help wrangle in everybody and bring them all together to work on the new state plan that our alliance is currently building. And please forgive my graphics and stuff. This was just a little hodgepodge throw together because it's not yet been printed yet. So currently, again, the alliance is working on that specific plan. And we'll move to the next slide. So the reason why I have this slide here is twofold. In our state plan, the Alliance has defined 7 specific goals. And one of those goals is really educating family caregivers, providing them the supports and resources they need in order to be well equipped to take care of or to be there to support their persons with ADRD. Another part of that the Alzheimer or the ADRD Alliance has said is that they would like to help make sure that it is not just that we equip caregivers, but that we educate our Idaho population, which includes Idaho employers, on the value of the family caregiver that they are employing for other work. And so I think that this is, something that's very timely with today's presentation, and something that is very important, not only to the ADRD program, but myself, and obviously to Sarah and the rest of the group. And so with that, I'm going to go ahead and close. We'll move to the last slide. And I please welcome you to join the ADRD Alliance if you would so like. We need your voice. We have some websites here up that are ours specifically, where we are putting out information. And of course, my contact information is there at the bottom of the slide. And with that, I do want to say thank you so much for allowing me to share space with you today. You will receive a copy of these slides, so you will get the links for these if you would like. Thank you.